Prescribing controlled drugs is an integral part of many psychiatrists' workday. And of course, being that controlled drugs are involved in the process, it's something that needs to be in itself controlled and something that is very secure, safe to use, and also easy. So what we've done at Medesk is we have created what's known as an overprint. And so it's something that allows you to print on top of the pink prescription pads that you use, so that you can save time on writing. And of course, it has a whole host of other benefits, such as being instantly more legible, much more likely to be accepted by pharmacies. And of course, it's just going to make your life easier and the life of your patients easier as well. And the way that we do this in Medesk is that we start our consultation as normal. We understand what we want to prescribe. We have a look at the BNF, for example, and we will choose a drug. So we might want to search for a drug, maybe even by part of the name. We can see that you've got generic names here, and you've got brand names on the left, as well as dosages on each. And so what we can do is we can pick a drug. We can say, for example, like this, and we can say how much we're going to prescribe. We might say when the prescription is going to end, and of course we may well state the diagnosis. So we're not going to make a real prescription, nor is it going to be accurate. This is purely for demonstration purposes. And obviously we're not here to be giving medical advice. So what we'll do is we'll finish this off. We complete our appointment with any other notes we may have made, of course. And what we can do here is we can now go to the controlled drug prescription. And what happens is you get this here. So you can see how you've got all the various bits and pieces about the patient. So you've got things such as their name, age and years, date of birth, address, of course, and postcode. Then you've got the information such as the drug and any other information surrounding that. And what you then have down the bottom, a series of X's to make sure that no one else can write anything over the top of that once you've printed things out. And as you probably understood already, this will then print out on top of your pink prescription pad, meaning that you end up with a prescription that you can then wet sign, and then you can pass on to the patient and then, of course, the pharmacy. So what it does is it makes sure that everything is nice and clear, everything is secure inside Medesk, and so you don't have to worry about having to write anything out, things to do with handwriting issues, for example, and so on. And furthermore, you'll notice that there are various different printouts available here. And what we do in Medesk is that we make sure that those printouts are available only to certain people. So it may be yourself as a clinician, it may be whoever's responsible for printing that, but essentially what we do is make sure that that's not visible to anyone who shouldn't see it. So anyone who shouldn't be able to print off a prescription for you. And of course, the very creation of the prescription information in the first place is something that is tightly regulated as well. So it'll only be available for clinicians as opposed to anyone who doesn't have prescribing privileges. So I hope there you can see in Medesk how you can create a prescription securely, how you can make it very quickly, and as I say, it will make your life a lot quicker. It'll make getting the controlled drugs that the patient needs much quicker, much more straightforward, much more standardized. And I think it will be of great help to you, particularly, as I say, in mental health. We release new videos every week. Hit that subscribe button to learn how to grow your practice faster.